There are more deaths from inactivity than there are from smoking, and that's a sad fact.
So, Professor Maria Stokes, you're very welcome. Thank you for joining me today. I thought maybe just an easy place to start, if you wouldn't mind, would be just introducing yourself and letting the listeners know a little bit about your background.
Thank you. Yes. Well, I trained as a physiotherapist many years ago, and I only actually practiced for 2 years before going into research. And I was a research physiotherapist with a doctor called Archie Young in Oxford, and he was doing his MD on muscle strength in older people. So I really developed a passion for muscle very early on in my career. I carried on doing some clinical work for a while, but I then did my own PhD, and it was actually at the time on thigh muscles and why they waste away when we injure our knees. So I've carried on. I've worked in various places over in Australia, and the whole area is trying to keep people active for as long as possible, however able they are. So whether they're healthy, whether they've got conditions that they're living with, like osteoarthritis or after a stroke. So really trying to keep people very active. And the area that I specialize in is neuromuscular activity. So this is about controlling the muscles in a way that make your activity safe. So we want everybody to be active, but as we know, if you're very active, you can get injured. So a lot of our work is actually trying to prevent that injury and not saying, oh, don't do your activities, but do it in a way that might be safer.
So, a good place to start, if you don't mind, would be just a little bit of the basic science. Tell us a little bit about the neuromusculoskeletal interaction.
Yes, so to understand the science behind how we move, we look at the biomechanics of how the body's moving. So we use three-dimensional motion analysis, and this is with a lot of sophisticated equipment in a laboratory. And we use a thing called electromyography, which is recording the electrical activity of muscles. We use ultrasound scanning, which you'll mostly know about from looking at unborn babies. But we use that to look at the muscles, look at the size of the muscles, watch them how they're working as well, so that we can really understand when something goes wrong after an injury or any disease, how do the muscles work, so that then we can work out the best exercises to actually overcome some of those impairments. So the science is not what you don't need that in the clinic, but to come up with the things that you can do in the clinic or in everyday life, we have to understand the science behind the mechanisms of how the body works in health and also when there are diseases.
So, what would you say would be some of the key findings from your research over the years?
Right. Well, if we take the example of back pain, which is a very common problem for people, um, back pain can go on for years in people, and it's always been a challenge for doctors and physios to really find out what are the best exercises for people to do. Years ago, you just have to go home and lie down flat for days. That was not good because the muscles just wasted away. So now, even when people are in a lot of pain, they're encouraged to move. And the question is, how should we be moving? Now, one of the things that we've really learnt from look at doing this investigative work is that the muscles, so particularly in the abdomen and around the back, work in a very coordinated way when there are no problems. When there are problems, some particular muscles waste away. They get switched off by the problem. And I mentioned that when I did my PhD, I looked at the muscles on the front of the thigh when you injure your knee. Now, they're the quadriceps muscle. When you injure your knee, the hamstring muscles don't waste away like the quadriceps muscles are. So it makes sense that if you want to rehabilitate the knee properly, you focus on the quadriceps muscles. In a similar way, in the back, you've heard of the core muscles, and that's the muscles of the abdomen. There's a deep muscle that's like a corset, and that does get switched off. And we didn't really know that until the work with ultrasound imaging. And you could look at the different layers of the muscles, and you can see that that muscle was just doing nothing when the other muscles were working. So we thought, right, well, how do we get patients to activate those muscles? And we used biofeedback. So this is work that was done in Australia when I was there. And there was a lady called Julie Hydes, who's now professor of physiotherapy there, who really brought this to the forefront. And they used the ultrasound as biofeedback so that the patient could see their muscles on the screen, contract and say, yes, that's the one you need to switch on. And it was a bit like a switch in that they didn't need to take a scanner home. Once they could feel what it was like and see the muscle working, then they were able to use that muscle. And that muscle works with the pelvic floor, which you'll have heard of. It works with the diaphragm, which is the large muscle at the base of the lungs. And these all work together to keep the pressure in the abdomen up to protect the back. So it may not make sense that you're working your abdominal muscles to help your back, but in fact, it's about the pressure. It's all about mechanics. And then, of course, the back muscles themselves, some of those switch off and others don't. They get overactive. So it's all about coordinating and relearning how to use the muscles. That's what neuromuscular exercise is about. And a lot of trainers, sports trainers now, when you look at these videos online, they talk about the mind muscle connection. And that's what they're talking about. They're talking about thinking about how you use your muscles in a correct way. And then that will become automatic. We don't have to think about it all the time. But when you've got an injury, you're trying to re-educate, you do need to think about these things specifically because they don't come back automatically.
So I've heard about neuromuscular exercises, but I would love if you would just explain what that is and then what are some of the ways that it's used.
Yeah, so neuromuscular exercise is really thinking about how you're working your muscles so that they move the body in a way that's efficient and coordinated. And it's just being conscious of, say, your posture and how the joints are sort of working in relation to one another. So an example is, if you do a very small squat, say, making sure that the knees are lined up over the toes rather than going inwards or outwards, because that puts a lot of strain on the joints and can cause injuries. And particularly if you're carrying weight while you're doing that, during exercise, if people are doing strength training. So it's really, yes, it's about being aware of how you're sort of using your muscles. And two main ways that these are used are in warming up before exercise and then in rehabilitation. So for instance, for warming up, let's take football, for example. There are a lot of injuries in football, and a lot of that can come from collisions, but a lot of them don't come from collisions. You often see a player just fall down. And so the warm up is usually or conventional warm up is that people do sort of stretching and running around. And they've found that actually static stretching before exercise doesn't actually prevent injuries. So it's more sort of dynamic movement and stretching. But then the added bit, the neuromuscular bit, is actually thinking about some of the movements that you might use in your sport, so that you would warm up specifically doing those. And so for like squash, changing direction quickly, and in golf, say, twisting the body around, swinging the arms, so that there's nothing suddenly expected. Muscles need to be woken up and switched on before you actually do that activity. So another way that neuromuscular exercises are used is in rehabilitation to help relearn how to move more efficiently after injury or if a joint's damaged from disease. And it's about moving in a way that keeps the joints healthy and getting these optimal movement patterns and repeating the exercises so that the muscle activity becomes automatic. Now, in an example of exercises for people with osteoarthritis that's been shown to be very effective at reducing pain and improving function and even delaying the need for surgery is a program called the GLAD program. It's the Good Life with Osteoarthritis in Denmark. And this focuses on, it has an education aspect to it, but also focuses on these neuromuscular exercises, thinking about moving the muscles in a controlled way, loading the joints in an appropriate way, and lining up, coordination and balance. Another area really is morning stiffness and joint diseases, warming up the joints before you get out of bed in the morning, even just moving the hands. So that's a very useful, practical use of these, sort of exercises for warming the muscles up.
So why does this matter for health? Let's start with what are the benefits if we do neuromuscular exercise well?
Yeah, so if we do this and we're talking about warming up before physical activity, then we're going to reduce injuries, and that's really important. And that means that you can then benefit from the regular exercise, like walking, running, and sports, if you like to do them, and really benefit from the sort of heart lung fitness, protection from various diseases like cardiovascular disorders like heart attacks, strokes, diabetes, dementia, as well as some cancers, and obviously managing our weight as well. So all of those things, you can really do the exercise well and prevent injury, and have all those benefits. The World Health Organization has a lot of guidelines, and they've got a very useful infographic called "Every Move Counts." Because if you're worrying that you need to meet all their targets, they're saying, well, actually, everything you do counts. So don't worry too much about trying to actually meet those. But it's just for being as active as you possibly can. So with injuries, if you have an injury or there's joint disease and things that need rehabilitation, then the purpose of doing this neuromuscular aspect of rehabilitation is to actually get more out of that more effective rehabilitation. And there are studies that have shown that this is the case. So, for instance, people who manage to rehabilitate those core muscles I talk about with back pain, they have less recurrence of back pain. It doesn't come back as much as when people don't do that. Um, and the same with other disorders, that you get much more effective rehabilitation. And I mentioned the GLAD program for osteoarthritis gets much more effective um, reduction in pain and improvement in function by doing those neuromuscular exercises.
And what are the downsides if we don't do it well?
Well, we know that if we're going to be active, there is obviously a risk of injury. So if we don't look after ourselves and do these neuromuscular warm ups, then we can get injured. And studies have shown that neuromuscular warm up exercises are more effective at preventing injuries than standard warm up exercises that don't think about this sort of controlling the muscles or practicing specific movements. So if we want to keep ourselves active for as long as possible and exercise for the next 20, 30, 40 years or so, we need to be aware of how to keep ourselves active all the time and prevent injury. So it's just really being sensible and having it as part of our activity program, really.
So, with regards to your work with rehabilitation, do you mind giving us just a couple of examples of some of the work that you've done over the years and what kind of new learning came out of some of those studies?
Yes, so let's start with an example of shoulder pain, which can be very, very debilitating, very painful thing, very common. And it's certainly more common in some sports than others. So with tennis, you get shoulder pain. You'll have heard of rotator cuff injuries. Um, and so these neuromuscular exercises, we've come up with some of these again by going back to the laboratory, studying what happens, how the bones are moving. So with the shoulder, there's a thing called a ball and socket joint, and you've heard of the shoulder blade and how they move in relation to one another. And we found that the muscles are very uncoordinated when you get shoulder pain, and you need to relearn how to use them so that the bones move well in relation to one another and don't cause all that pain. So, a very simple exercise that we did um, was literally 2 minutes twice a day for 10 weeks. I didn't believe this would work, but it did. Of lifting the arm in a particular way, taught people how to switch the muscles on properly. Because what was happening was they'd lift their arm up, the muscles wouldn't switch on early enough to get the shoulder blade out of the way and was sort of trapping the tissues. And when you lowered your arm, the muscles were switching off too early. So the shoulder blade wasn't moving properly in relation to the upper arm bone and humerus. So this was a really important finding, and integrating these very simple exercises into rehabilitation has really changed the way we can manage something like shoulder pain. And this is very similar to other joints like the hip as well, and back pain that I mentioned about the deep abdominal muscles. Really focusing on those muscles so that they come on and switch on automatically. So when we cough, for example, those muscles and the pelvic floor, all the core muscles actually work to brace our spine automatically. But when we've got back pain, they don't come on. So when you cough, it can be really painful because the muscles aren't working properly. So It's rehabilitating these muscles, practice, 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 so that they come on automatically.
So is it a case of just strengthening, or is it more to it than that?
That's a really good question because when you're using muscles that you need to use all day, it's not about them needing to be strong. It's about them needing to have endurance so that they don't get fatigued. So, um, a problem that some people do is that they over strengthen the muscles for the back and the pelvic floor so that they can't actually work for long periods. And you can actually get stress incontinence from that. You can also make your back vulnerable because the muscles become very tired. So when we rehabilitate these muscles, particularly for back pain, they're very low level contractions to improve the endurance of the muscles and not particularly making them very strong. And that's a very important thing to realize. So when we think about a 10-story building and a lift going up to 10 floors, the level of exercise we don't want it going up to the eighth or the 10th floor. We want you to just go to the first, second, maybe third floor in the strength of doing these exercises for the core muscles. So the transversus abdominis muscle that acts as a brace for the back and the pelvic floor muscles.
How does modern life impact neuromuscular function? We hear this a lot, that we're a bit less active than we used to be. Has that played a role in this?
Well, yes. I mean, we're certainly less active than we used to be, and that's where all the statistics for the effects of inactivity are quite worrying, in that there are more deaths from inactivity than there are from smoking. And that's a sad fact. And I think if we put as much effort into um, improving our activity and as we do in trying to get people to quit smoking, then I think we'd be able to really reverse that fairly quickly. But things that we can do in our everyday life are very important to be aware that we're less active. So if we get the bus to work or down to the shops, to get off the stop earlier, just to integrate things into our lives like that. But yes, it is a sad fact that the way things are and the way we're reliant on computers, that we are sitting a lot during the day. So if we have to do that, then we need to get up and take breaks away from the screens, be aware of our posture while we're at the screen, because that causes a lot of neck pain and back pain, sitting at screens.
I seem to see a lot of neck problems, and they all seem to be people sitting at computers for long periods of time. And I'm sure there's a lot of advice out there, but it doesn't always seem to reach the people that it matters most to. Any just basic key principles that we should be aware of for people who use computers a lot for their work?
Yes, certainly. And it's about being aware of your posture while you're at the computer. Because when you think about it, the sort of stimulus for injuring yourself is hours and hours and hours. So it's bound to have an effect. And if you're not aware of your posture, if you're not trying to stay in a good posture, then you are going to have problems. Another thing is to do some exercises and tucking your chin in. There are really good exercises on the NHS website about this and other websites. But if you're not aware while you're doing it, just doing a couple of minutes exercise isn't necessarily going to reverse it. So it is about taking the breaks while you're at the computer and being aware of your posture and having the right support, and having a computer screen in the right place and at the right height. A lot of people get advice for this at work, but if you're working at home, you may not get that advice. You need to really think about and find out how to set up your computer equipment, and really do take those breaks from the screen and do some exercise and keep in a good posture while you're at the screen.
And we'll put some links in the show notes as well to some good advice on that. Okay, so I thought we would try, and I know this is a little bit unfair because your career has been really in rehabilitation, injury, and rehabilitating from that. But I wondered whether there's even some things that we've drawn from your experience that we can apply in everyday life. So I just thought, what are some of the key things that maybe we should think about for those that are starting or their kind of health and wellness journeys? What are some of the key things that we should think about?
Yeah, well, from a sort of physical activity side of things, do activities that suit you, that are you're able to get to easily and they're affordable for you. Because if they're not, and it's too far away, you've got to travel far away to do it, you're just not going to keep doing it. So it's things that are going to be sustainable. We mentioned about warming up before you exercise. And if you're taking up a sport, don't start too intensively. just gradually get into it. Um, if you're going to buy gym equipment, make sure you get training in how to use it, because that can cause injuries, people using these things at home. And also wearing the right footwear when you're exercising. And again, that doesn't have to be very expensive. It's just being sensible about how you choose what to wear. And then just with the principles of warming up, it's about 10 minutes a warm up is quite good. And so examples are marching on the spot, just rolling shoulders, just general things. And you'll find all of these on websites, on NHS websites. Um, then before a run, doing a brisk walk. And then for specific sports, it's about practicing some of the movements that would be in that sport. So, say, turning the body, swinging the arms for golf, lunging, rapid movements, changing direction for squash and football and tennis. So, things that are appropriate to the activity that you're going to do. And some of the warm up exercises, and again, there are a lot of these on websites, and they do include the neuromuscular aspects that we've done in our research. So, moving in coordinated way and doing balance exercises. And for the gym, you could walk there, and that would be a good warm up for going to the gym, and then walking home for doing a cool down. Stretching is something that people tend to associate with warming up, but in fact, there's no evidence that static stretching um, helps to prevent injury. And it's the dynamic stretching that's more important, but you in fact do that when the muscles are warmed up. So if you're thinking about cooling down, that's as important as warming up, because it helps the heart rate to come down slowly. And so if you've been running, then you might end up doing a walk. With swimming, end up doing less intensive, do some slow laps. And the idea of stretching is while the muscles are warm after you've done this work. So you can do it standing or lying down, stretching the shoulders, the backs, the hips. Again, there are lots of examples of doing these that you can find on websites. And so overall, warming up is dynamic, and it's getting the muscles moving, and the heart rate going up, and practicing maneuvers that you might be doing during activity, while the cooling down, it's helping the heart rate to come down slowly and stretching the muscles while they're warm.
So, if there's someone listening who maybe has a physical challenge, who would love to exercise and just hears about all these intensive things that are a bit of a more of a challenge for them, would you have any messages for those people?
Yes, very much so. I think everybody needs to move, and we need to move within our ability. So I think if you have a particular condition, so for instance osteoarthritis, or you've had a stroke, or you have a cardiovascular disease, or a breathing disorder, I think it's important to get some advice on how to exercise safely. And there are a lot of resources available at the moment. Versus Arthritis has an excellent resource on its website for people exercising with joint disease, and other charities have similar, dedicated activities to help people exercise. And people in wheelchairs can do sitting exercises, or wheelchair users can actually exercise and go to the gym and play a sport right from sort of local level to elite sport. And again, it's according to your ability and your interests. So everybody, please try and exercise as much as you can. And there are places to help you do this if you can seek them out. But I think it's important not to just try and exercise from the internet. I think it's going to be really important that you do try and get advice about this from health professionals.
There could be people listening who are at all ages, even in their latter years. And I just wondered if you had a message for people, even at that stage of life, who are maybe wanting to start or increase their physical activity.
Yeah, definitely. All ages need to be exercising, and there's evidence that particularly older people, if you exercise, you're going to have less problems. You're going to have less falls, less need to go to the hospital, and lots of evidence for that. But as for taking up exercise, yes, there's again a lot of evidence that it doesn't matter how old you are, you can still improve your cardiovascular fitness, your muscle fitness. And the World Health Organization guidelines do change for once you get over 65. So not only do they say that you need to be doing this 150 minutes a week of cardiovascular training, but you need to do more strength training and more balance training as you get older. And again, that's mainly to prevent falls. So very important to do that. And some examples of activities that people can do. I mean, again, don't necessarily have to do sports, and definitely don't have to go to a gym. You can go for walks with family, go to the shops. I mentioned get off the bus and stop earlier, doing housework, gardening, playing with children, and exercise classes are very useful if you're happy to go to those. And for older people, Tai Chi is particularly good for balance. If you don't want to do exercise in public, you can do classes online at home, but do be careful. I mean, they do have a lot of exercises online specifically for older people. Some of them are with you seated in a chair, some of them you're standing up. But one simple exercise you can do at home is standing up and sitting down. And I actually got a lot of older friends and relatives to do this during COVID when we couldn't get out much. And there's evidence that's saying that if you do this 45 times a day, so that's say 3 lots of 15 standing up and sitting down, which you can do while you're waiting for the kettle to boil. And that has been shown to help your strength and your balance and your fitness. And then a balance exercise you can do standing on one leg, making sure you're near something if you do lose your balance. But you can do that when you're watching television, or washing up, or brushing your teeth. So just integrating those simple things into your everyday if you don't particularly want to do actual sports or activities outside.
Anything coming in the near future? Any exciting developments in exercise science that we should know about?
Well, I think a lot of this is going to come from human space research because astronauts have got a very good model for wasting, so sort of aging and things that happen with injury as well, because it happens because of the microgravity, the lack of the effects of gravity on their muscles. They waste away very quickly. And so they have to do a lot of exercise in space. And what's going to be very interesting is these longer missions to Mars, where they won't have the room in the spacecraft to have all this equipment. They're going to have to think of innovative ways of keeping the muscles working healthily. So they're going to need to develop some new things. And I think the spin off from there will be very useful for us on a not just for aging, but for people who might be in intensive care, who were healthy and suddenly not, and have this imposed bed rest. They're going to have to think of ways of keeping their muscles going while we wait for them to recover. So one example is electrical stimulation of muscle that's been tried in astronauts, and again combined with the nutrition to keep the protein in the muscle as well. So I think a lot will come from space research that will be helpful to us on Earth.
So, Professor Stokes, thank you so much for joining me today. That was really fascinating. Just as a final little step, would you mind just, what would be your kind of key message that you would wish to leave the listeners? And let's start specifically with physical activity and health.
Yeah, well, just keep moving within the ability that you have physically and also socially and environmentally. Just use what you have in your immediate life. So integrating physical activity into your everyday life so that you don't really need to worry about specific exercises. They might not always be needed. But trying to exercise safely to prevent injuries. And then if you do get injured, to exercise your way out of that so that you can get back to your general activity and try and do things that you enjoy. If you don't like activity, then I think there are clever ways of actually making sure that you are more active in the way that you have to go about your life.
And just any little final things, even outside of your own kind of research interests. Obviously, you've been around the health and wellness space for your career. Any other kind of little health and wellness tips or principles that you've picked up along the way?
Yes, well, generally, I mean, we know a lot more about staying healthy, and we've talked about exercise today, but obviously, eating well, eating a balanced diet is just so important. If we don't give our muscles the energy to use them, then we're not going to be able to exercise and keep fit and healthy. And just little examples about walking after a meal, for instance, as simple as that. So, a 10-minute walk after a meal, keep the blood sugar steady, trying to sleep well. And keeping stress levels down is a big one for us these days, very difficult. Personally, I do mindfulness. I find that very helpful for keeping the stress levels down. So, just the sort of all these things are related. So, it's just thinking about getting a sort of a balanced life, really, and not just focusing on one thing.
Professor Stokes, I'm very grateful. Thank you very much for joining me today.